Hello friends, let's see the most favorite muscle of the examiner, and that is the biceps brachii, which is the muscle of the anterior compartment of the arm. So when we draw the section of the arm, we can find this one is the skin, and just under the skin we find the deep fascia, and most deeply the humerus bone lies. So this one is the transverse section of the arm. From the humerus, the extension of the deep fascia, it reaches up to the medial border and the lateral border respectively. And that extension, it is called as the medial intermuscular septum and the lateral intermuscular septum. This biceps brachii muscle is situated in the anterior compartment of the arm. So here, this one is the anterior compartment of the arm. So this biceps brachii is the flexor group muscle of the arm. Now let's move on to the detailed anatomy of this biceps brachii muscle. So here this one is the schematic figure of the biceps brachii, and here we can appreciate that the muscle is going to arise by the two heads as the name suggests. One is the short head and one is the long head. So let's see the origin of this biceps brachii. This particular point is the origin of the long head of the biceps brachii muscle. This long head of the biceps brachii muscle, it is the intracapsular muscle which is going to arise just above the glenoid cavity, and that area it is called as the supraglenoid tubercle. The supraglenoid tubercle is situated just above the glenoid cavity and it is surrounded by the capsule of the shoulder joint. That's why this long head of the biceps brachii muscle is the intracapsular in nature. When we see this long head of the biceps brachii, it arises as a tendon from the supraglenoid tubercle and it passes above the humerus bone and it runs within the bicipital groove of the humerus, and this bicipital groove of the humerus it is bridged by one ligament, and that ligament is called as the transverse humeral ligament. So this long head of the biceps brachii muscle it runs deep to the transverse humeral ligament, and this transverse humeral ligament it is going to bridge the bicipital groove. So this long head of the biceps brachii it has some anatomical importance that it is an intracapsular muscle, and another muscle which is intracapsular in origin, and that one is the popliteus muscle of the lower limb, which we are going to see in the lower limb section. Now the second head of the biceps brachii is going to arise from this area, and this one is the short head of the biceps brachii. This short head of the biceps brachii it is going to arise as a tendon from the coracoid process. So from the tip of the coracoid process, the short head of the biceps brachii is going to arise as the tendon and it passes downward. So the short head of the biceps brachii, it is situated little medial to the long head of the biceps brachii. And both the heads, they are going to fuse with each other at the distal part of the arm and going to form a tendon for the insertion at the radial tuberosity. So this is the area where the muscle is going to insert. So here this is the area and this one is the radial tuberosity. The tendon of the biceps brachii is going to insert on the posterior part of this radial tuberosity, while the anterior part of the radial tuberosity it is covered by one bursa, which prevent the friction of the tendon with the bone. Before going to insert over the radial tuberosity, the fibers of the tendon of the biceps brachii, it is going to form one aponeurosis and it passes on the medial side. So this downward and medial extension of the tendon of the biceps brachii muscle is called as the bicipital aponeurosis. This bicipital aponeurosis, after getting origin from the medial side of the tendon of the biceps brachii, it runs downward and medially and going to reach up to the deep fascia of the forearm. And through the deep fascia is going to insert over the posterior subcutaneous border of the ulna. The clinical importance of this bicipital aponeurosis is that under the bicipital aponeurosis, brachial artery lies, and over this bicipital aponeurosis, the median cubital vein lies, and these are the structures which remain in their position because of this bicipital aponeurosis. So this one is the insertion and the origin of the biceps brachii muscle. Now let's move on to the nerve supply of the biceps brachii muscle. The musculocutaneous nerve, which is a branch of the lateral cord of the brachial plexus, is going to supply the biceps brachii muscle. The root value of the musculocutaneous nerve is C5 and C6. So the C5 and the C6 nerve root, they are responsible for the tendon jerk of the biceps brachii. Now let's move on to the most important part of this muscle, and that is the axon of this muscle. When we see the axon of this bicep brachii muscle, it is the chief supinator at the time of elbow is flex. So at the time of the screwing movement, the supination of the forearm is responsible, and this supination at the time of the elbow is flex is the axon of the biceps brachii muscle. So whenever examiner asks you in the exam that what is the axon of the biceps brachii muscle, the first answer should be it is the chief supinator at the time of elbow is flex. The second important action is the flexion of the forearm. So the flexion of the forearm, it is also one of the important action of the biceps brachii. But the chief flexor of the forearm is the brachialis muscle, which lies just under the biceps brachii muscle. So another action of this biceps brachii is the flexion of the forearm. And the very little action over the shoulder joint is also there by this biceps brachii, and that is a weak flexion of the shoulder joint. The main flexor of the shoulder joint is the deltoid muscle, but this biceps brachii, as it is going to cross the shoulder joint also, because it is going to arise from the coracoid process and supraglenoid tubercle, that's why the contraction of this muscle will also lead to the flexion of the shoulder joint, but this action is very weak. So this is all about the biceps brachii muscle. Hope you understand well. Thanks for watching.